Well, hello everyone and welcome to the Radiology Gym. Don't forget, your brain is a muscle. If you don't use it, you'll lose it. So keep practicing. Let's go to the Radiology Gym. I'm Dr. Ahmed Abdulwahab and I'll be your coach for today. Stay with me. Hello, my friend.
Hello, sir.
It's been a long time since I've seen you.
Well, I'm sorry for that. I promise I'll be back even more, but I was a little bit busy these few days.
Well, no problem. We can always keep practicing. So, do you want to do any exercise today?
Yeah, sure, that's why I came.
Okay, so let's start. No need to waste time. So, this is a case of a 50-year-old male patient presented with gradual shortness of breath and coughing. So, chest CT was recommended.
First of all, let's see the survey. Like a form of a chest x-ray. Well, on the survey images, it's not very clearly seen, but I think there is some sort of ill-defined area of ground glass opacities, probably here. Maybe something here, I'm not so sure. I would not comment on that, and I would go straight for the chest CT.
Okay, that's good.
Okay, these are axial images of a lung CT scan, chest CT scan, lung window. I would scroll through it just to have an idea of what's going on. Okay, now can I see the soft tissue window?
Nice.
So these are the soft tissue window images of the patient, and we will scroll through it. Okay, I want to see coronal images, please.
Okay, no problem.
These are the coronal deconstructed images, lung window of chest CT scan of this 50-year-old male patient presented with cough and shortness of breath. And I can see on these images that there are multiple patchy areas of probably ground glass opacities in both lungs, prominent on the right side. And the thing is, if we go back to the axial images, if we look at them carefully, we can see first they are mostly ground glass with probably small parts of consolidated lung, and they are located mainly peripherally and mainly posteriorly. And we can see that the anterior aspect of both ones is relatively preserved. There are some faint ground glass opacities probably here, but otherwise there's also another small one here, but they're faint and they're small, and it's mostly in the posterior peripheral parts of both ones. And if we go to the soft tissue window, we can see that there is no pleural effusion with that, and we can see in that there are only a few small mediastinal lymph nodes here and there. Again here, some small mediastinal lymph nodes, probably not much of a significant mediastinal lymphadenopathy.
Excellent. So, what's your impression of that?
Well, considering bilateral distribution, asymmetrical of areas of patchy ground glass opacity, I would think of a differential diagnosis, like for example, atypical pneumonia. Viral pneumonia is a good candidate.
Good job. What else?
Well, the possibility of interstitial lung disease should be considered. For example, usual interstitial pneumonia would be a good candidate here because of the peripheral distribution. However, usual interstitial pneumonia usually presents with apico-basal gradient. We can see that the apico-basal gradient is not very obvious in this regard.
So what do you mean by epicobasal gradient?
Well, I mean, the pathology or the abnormality should be less prominent at the apex, and as we go down, it should be more severe. But here, I'm not convinced that there is epicobasal gradient.
Okay, what about here?
Well, here we can see that although it's present, the pathology, the abnormality, the ground glass patches is present, both superiorly and inferiorly, but there is no gradient. It's the same. It does not increase as we go down.
So what about other kinds of interstitial lung disease? For example, non-specific interstitial pneumonia.
First, non-specific interstitial pneumonia are more common in females, and probably it usually presents with ground glass opacity, but usually it involves both lungs in a diffuse symmetrical manner.
Very good job. So what's your primary differential diagnosis?
Well, I would say atypical viral pneumonia.
Can you name a specific viral pneumonia?
I am afraid to say it, but I'm thinking of COVID-19 pneumonia.
Why you're afraid? You're absolutely correct. This is a case of COVID-19. Although it's been under control, but we need to not forget the features that the COVID-19 causes.
Well, I'm so happy that I got it right. Thank you, sir.
Thank you, dear. See you later.
Thank you. Bye-bye.
So this was our exercise for today. Don't forget to like, subscribe, share, and tell your friends about us. If you want any private training sessions, send a message to the email in the description box and we will arrange something. Bye.